the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. The time now is 6:23. What may not affect one person's allergies may be agony to another. Well, either way, this time of year is an allergy pain for many people here in Arkansas. Dr. Laura Lester from Baptist Health Family Clinic Malvern is here with ways to stay on top of your allergies. Good morning to you. Thanks so much for being here. This is timely, of course. We're creeping into spring, warmer temperatures. We're seeing some of the Bradford pears blooming and a lot of things
it's beautiful
out there.
and terrible at the same time.
Right. For anyone that has allergies, when does the season really start?
In Arkansas, probably at the end of February. No, usually once that freeze stops, it gets really bad, and people start getting out and trees start blooming, and right around the middle of March it starts to flare up.
And there's a lot of people that go, okay, do I have a cold? Do I have allergies?
Yes.
How do you know if you're allergic to something?
Usually you don't have fever with allergies. I mean, you can have a lot of the same symptoms, the runny nose, the cough. There's a lot of itchiness, itchy throat, itchy eyes, things like that. But you don't usually have fever with the allergies.
And you can know for sure if you get tested, and that's really what you're talking about today. So who needs to go in and get tested?
So people who have allergy symptoms despite taking allergy medicine like antihistamines and nasal steroid sprays, those are the treatment for allergies. But if you're still having the symptoms despite taking those every day.
And some people can get the relief from those things.
If you get relief from it, great.
Okay.
But if you're still having the symptoms, or if you're having to take those every single day, that's crazy. If you move to a new region, even if you're in Arkansas, like I used to live in Northwest Arkansas and moved here, and they changed just in the state. If you haven't had one in like 3 years, and you're having the symptoms again, even if you've done the shots, these are some bad. This isn't mine, but this was what mine would look like. I'm allergic to everything.
And this is the testing, how it's done. So explain that process as people are seeing these pictures.
There's different things they test for. We test for the most common ones in our clinic, but the allergen is placed on your back or on your arm. It's not a needle. It's just a little plastic thing. It doesn't hurt. The worst part is the itching if you have the allergy. So you can see the welts there. That's my husband getting his. So that's the little tool they use to put it on your arm, and it just introduces it right into the skin, and if you're allergic to it, you will form that giant wheal, and that's how we know.
And the benefit to that is that then you can specifically treat those things.
The results of that are sent off, and you get a serum that's specifically for you, and just your allergens are put into the serum in a certain amount based on your allergy response. It's all very technical, but then you get injections. They're small. I promise I rarely feel mine, and I'm a weenie. But you get injections that slowly get a little bit stronger in concentration over the next few months. And the idea is that you slowly desensitize yourself to that allergen, and you don't have those responses anymore.
And it can be life-changing. You've seen it with patients.
Oh, yeah. I've seen it with myself. It's great. I mean, it is. It's really good. And if you're living on multiple allergy medicines, it's time.
Certainly worth checking out with your doctor. Get those allergy tests. Now's the time to do it as we're creeping into allergy season. If you have any questions, you can always call the Baptist Health Helpline at 1-888-BAPTIST. And we want to say congratulations to Laura. Dr. Lester is expecting a baby boy in June, so we're looking forward to following that.
Thank you.
And then you'll have a little break off from the show.
Yes, I will,
so we'll miss you for a little bit, but congratulations.
Thank you.